You all today. My name is Steve Smith, Experiential Consulting, and I have a fantastic lineup of panelists here today that are going to share their lessons learned by running their programs this summer during the pandemic, and kindly coming together to share what they learned from that with all of you and with each other. So we have Geoff, Steve, Josh, and Jay, and they'll introduce themselves more thoroughly in just a moment. They represent these organizations: the Northwest Youth Corps, Trailkeepers of Oregon, the YMCA Bold and Gold program, which started right here in Seattle, Washington, and the Montana Wilderness School. So thanks so much to the panelists and to those organizations for making time to spend with us all today. So a couple words of framing here from me. Everyone, there was a couple of you that I wasn't able to unmute because for some reason you had an older version of Zoom, it said. But for the most part, everyone on the call should have the ability to unmute yourself and speak up when you wish. But we ask that you do stay muted to just minimize the background noise. There is a Q&A box, and we would invite you to load that up with questions, and we'll make sure that we go through those during or certainly by the end. There's the chat box as well that you've already been using, that you're welcome to use to interact with each other, to make comments, to share links and resources and all of that. I also just want to say that we're really glad you're here. Please do participate and engage and ask questions, but also make space for others to participate as well. And we've got lots of different kinds of programs represented not just by the panelists, but by the participants, and would really invite you to be open to those differences between your different programs, your environments you work in, your populations you work with, your actual missions, your reasons for existing, the educational outcomes of the program, and all of that. So really invite an open conversation here today to share and learn from each other. A couple words for me. I've been working with programs all over the country in very different slices of the outdoor industry. And COVID has really posed remarkable challenges for our industry, but it's really been unevenly impacting different sectors, I would say. And I've seen colleges and schools really being the most heavily impacted, as a lot of those outdoor programs operate within a larger school environment. And they've been very tied to and coupled to the way that the school makes decisions. And the outdoor programs haven't necessarily been the priority for understandable reasons. I've seen outdoor wilderness programs, outdoor education programs really unevenly impacted. And I think Josh is going to give a great example of how a local program might be able to thread the needle and find ways to operate during COVID in ways that maybe some larger organizations weren't as able to be that nimble. Conservation corps also unevenly impacted, but many operated during the pandemic as essential services or disaster relief or whatever it might be. So we're going to hear from several conservation corps teams about that. And then wilderness therapy programs as well, also unevenly impacted, but many of them also classified as essential services and able to operate during the pandemic. Healthcare, basically, for their students. So just a little framing from me of this topic. And without any further ado, we're going to go into the presentation here, starting with some 5-minute introductions and brief overviews and stories from each panelist. Where some of the topics we'll touch upon include criteria for assessing risk and how did they decide if they're going to run their programs or not? How did they monitor those things? A theme that emerged in our practice session that we did was really just talking about risk tolerance and some potential differences in risk tolerance between participants, staff, leadership, the board, pieces like that. We're going to talk about what impact COVID has had on equity and inclusion efforts at these organizations. I'm particularly interested in this concept of emergent risks, ones that weren't there to begin with, but which arise from our management of other risks, like a mask that makes your glasses fog up or things like that. So that's an interesting topic. We're going to end with just advice that these folks have for programs in 2021, and certainly take input and questions and comments from all of you as well. So with that, I'm going to stop sharing my screen and turn it over to our panelists to go ahead and introduce themselves. We're going to start with Jay, then we'll go to Steve Kruger, then we'll go to Geoff, and we'll end with Josh in those introductions. So Jay, please take it away.
Thanks a lot, Steve, and welcome everybody. I'm now finally seeing some faces, which is really fun. My name is Jay Satz, and I'm the Senior Director of Partnership and Innovation for Northwest Youth Corps. I also serve on Geoff Eseltine's board over at the Seattle YMCA's Camping and Outdoor Leadership branch, where I chair the Risk Management Committee there. And on occasion, I get to work with Steve at Experiential Consulting. And it's been a very, very meaningful 6 months of having 3 different perspectives to manage around COVID. My personal pronouns are he and him, and I'm really excited to be here today. So first, I'll give you a little bit of a linear sort of timeline for where we were at. And then I'm going to become very unlinear and be very popcorn around a topic that Steve has asked each one of us to cover in 5 minutes that we could talk to you each about for 5 hours, which is the impact of COVID. For where it started for me, was in February in Washington, D.C., and several people on this call were there. Hi, Liz and Jill and Steve. We were at the Core Forum, and we were doing our business where we all get together once a year, but the news was getting really weird, and we were starting to hear about COVID. This is early February, I think the second week of February, to the point where when we were Steve and I were getting on the plane to head back to Seattle, I turned to him and I said, I think this may be our last plane ride for a really long time. And then got home and just kept focusing on things. We had an in-service for all of Northwest Youth Corps in March, and I realized that I typically fly down to Eugene and I didn't want to. I decided to drive. And while we were there, the second week of March, the world sort of compacted on us. Our physician advisor, Greg Moore, called. I had reached out to him 2 weeks earlier. I said, what about COVID? He said, I think we're overreacting. We'll just wait, we'll see. And then on March 11th, Greg texted me and said, I want to talk to you about ceasing operations at Northwest Youth Corps. And we had 4 crews out in the field at that time and about 30 interns. And while we were together, we just had that sense of the world collapsing around us. I ended up talking to my dear friend Todd Schimmelfennig 5 different times a day for a couple of days as we were watching Knowles go from, okay, how do we manage each one of these pieces to we have to really rethink things. And then I was talking to other folks in our conservation corps. We were all just really trying to figure out what was there. And we had a candid conversation with our senior staff, and Greg, our physician advisor, decided not to pull our crews in because they had been out for 8 weeks and they had 2 weeks to go, and they were probably in the safest place they could be. They were in the backcountry. They were by themselves, even though we didn't have any protocols. Dealing with COVID, we communicated with them, told them to keep to themselves. Greg agreed that they were safer out there than anywhere else. We also kept our interns in place if they could work from home. And so we were working on doing all of that. And then we spent about 5 weeks going through a lot of internal trauma. And trauma is a word I think that we should use a lot regarding COVID. And that's going to come up a lot. We so focus on how trauma impacts potentially our crews or our field staff. And administratively, we were feeling the trauma of wondering whether we could keep our organizations going and whether we could keep our missions going. And we spent that time building protocols to see whether we could operate. And we made a decision early on that we were going to be incredibly transparent and we were going to be sharing these protocols. And we engaged Steve as an advisor, Greg Moore was an advisor, Dave McAvoy at Erie Backcountry Medicine, on whose board I also serve, and just feel that Dave is an extraordinary resource to our industry, and as a practicing paramedic was really tied into getting Missoula ready for this pandemic, and that knowledge was incredibly valuable. And our timeline went from, we pulled those crews in the end of the third week of March, and between then and May 22nd, when we went back into the field, we were just focusing feverishly on how to keep our organization going, including salary cuts and temporary layoffs, and figuring out how to utilize the PPP program, from the COVID Relief Act that came in. And when we launched again, we ended up with a program where we had 40 crews out between May 22nd and the last week of November in 3 different states and 105 interns. And we actually had 3 cases of COVID in our intern program, all minor. 2 of them were non-symptomatic. Our cooperating partners were incredibly responsible. And somehow in these 350 people in these 40 crews where we had no COVID, I'm not sure we'll ever understand why that happened. I think we were lucky. I think that luck also favors the prepared, and having these COVID protocols were incredibly helpful. We immediately shared them with folks, and we really got great feedback. We learned from sharing, and so folks had great takes on specific areas, but we were struggling even as we were getting through. And a couple of things that I'll just highlight was we were just crushed by the disconnect between our commitment to diversity, equity, and inclusion in our programming and the things that we needed to do to keep people safe. And so when we asked people to self-isolate for 14 days, that requires you have a certain amount of privilege to be able to be somewhere where somebody can take care of you and where you have the opportunity to do that. We discouraged, at least in the beginning, before we fully understood things, to use public transportation to come to our programs. Again, that is privilege, the ability to have your own vehicle and to get to our programs. We had to cancel 2 premier programs, our American Sign Language Inclusion Program and our Native Steward Program. Our relationship with the Chamawa Indian School and the tribal areas that we served, they were struggling already, even in the earliest days, with a higher level of COVID impact. And our concern was, even if folks could self-isolate, we were deeply concerned about sending somebody potentially infected back into those communities. We struggled with what the meaning and expectations around HIPAA and HR were in terms of what we could ask our staff to do in order to be safe, and whether or not it was appropriate or it was possible to regulate their off-program conduct in order to keep some of these things safe. We were struggling with how data was changing, the things that we were learning. We went from having the most crazy amount of sanitizing to the point where how you sanitize a tool handle, to realizing this thing is airborne, that those things might make folks comfortable in a crazy world, but that was not where our greatest risks were. So we were dealing with how safe staff felt and what was appropriate to be asking of staff in terms of their exposure. And we were dealing with the fact that even though we have staff in 3 different offices in 3 different states, the bulk of our staff are in Eugene, and the way that they interact with each other is by being there together. And all of a sudden we were all remote workers and trying to figure out just how to do that. So the final thing that I'll say, because I can't wait to hear what my co-presenters are going to say, is that the one thing that was not clear to us at the beginning that became one of the biggest parts of what we needed to do is, like, once we were building our protocols and building our own confidence that we could do this, our land management partners were not willing participants. And that was for a lot of legitimate reasons. Their administration was pretending that this didn't exist. And there were just so many legitimate and concerning issues around just staff safety, particularly at national park and forest sites, where all of a sudden the public was overrunning them for outdoor recreation opportunities because other things were shutting down. And so it was very, very hard. And there were some places we ended up not working, but mainly we were working on convincing our extraordinarily besieged partners, wonderful human beings that were just struggling with their own realities of trying to figure out that mix between their own personal protection and trying to protect the resources that we're in charge of. Ultimately, we were successful virtually almost everywhere we went. There were a couple of places we ended up not serving, but that was a whole other fascinating part of our sort of COVID response that was unanticipated. So I'll stop there and look forward to getting in more specifics when we get into the subject matter pieces. But thanks for this opportunity to chat for a bit, Steve.
Let's go to Steve Kruger.
Yeah, great. Thanks, everybody. My name's Steve Kruger. I'm the executive director of Trailkeepers of Oregon. It's a nonprofit that I figure I share my screen and our website. You know, unlike our other presenters here, I think I'm a little bit the difference. You know, a lot of youth programs from our other panelists, whereas our group really, our bread and butter is bringing community members, both local and traveling, you know, between 25 and 50 miles to 100 miles to sites for sometimes just day trips, where they show up at a trailhead, they volunteer for the day doing trail work, and then head home. And so this is us, Trailkeepers of Oregon. You know, this is kind of the impact that we've made across the state in normal or in years that we intend to rub elbows and snot and spit all over each other out in the woods. But you know, we're a growing nonprofit. We actually I was the first staff person in 2017. So we've got 5 staff now, and doing a lot of work and growing. This year has been challenging, obviously, with that growth. We were on an exponential uptick, and then COVID hit us. My story is really similar to Jay, and I didn't realize this. I mean, we had a TKO leadership summit, over 40 people from our board, staff, and crew leader programming. So volunteer leaders that lead volunteer crews. We were out on the Oregon coast at a kids, you know, an outdoor school camp, mess hall, shared, you know, sleeping space. It was the last weekend of February. And that weekend in Oregon, we heard news the second day that the first case in Oregon was found in Lake Oswego, just right outside of Portland. And, you know, then that buzz occurred. We ended up, you know, bumping around, learning with everybody else in March. And, you know, Friday the 13th was the day that we postponed and shut down all of our activities. We hunkered down. We moved to a lot of digital engagements. Like so many people were just like, okay, if we can't see each other and be with each other in person, what can we do now? And we were learning all these skills as staff and lead volunteers and Zooming and whatnot. And right in the midst of that, it was, how could we do what we know is safe outdoors and what is, you know, being communicated to us as the best place to be, and, you know, keeping our dime space. What do we have to add to keep people safe? Because we feel like we can bring people together in a safe way. I reached out to Jeff Parker of Northwest Youth Corps. He immediately showed his website, and I was like, gosh, these guys already have protocols on their website, end of March, I think, maybe early April. And we then reached out to Steve Smith here as a consultant and helped us out. We had never had a health advisory group. We formed that from board members who are retired nurses and crew leaders who are retired doctors and other folks that are, I mean, even folks who have the right brain for it, of the right and left, of like a retired civil engineer who, we brought that team together, Steve, right? And we pulled the resources and gleaned that from others. I mean, you can probably all have these flashbacks of those moments of reaching out to all those partners and collaborators out in your world and starting to do these Zoom meetings where you really didn't have an agenda. It was just like, oh, I got to talk to somebody. And then you start forming an agenda and a purpose for your meeting. And, on Fridays at 3:00, I had a group from the Columbia River Gorge that included Washington Trails Association, PCTAs, all their regional staff, and Friends of the Gorge, nonprofit partners that work in these local, state, and federal lands. And we just, had those Friday meetings. Each of us were pulling our drafts of those COVID protocols. And for us, over the course of May, we developed those, got those succinctly put in place. Certain land managers were ready for us. Others were definitely not. Others wanted to, forest by forest, ranger district by ranger district, state park management unit by management unit, local and regional partners. Everyone is in a different place, working from home, trying to struggle with all the things personally, and then also still manage partnerships and everything like that. This is where we're at now. We have a web page that, if a volunteer wants to get involved, this is how they do it. Step 1, watch a video. Step 2, watch another video. Step 3, watch more videos. We've developed all these over the time. There's a theme for us around before an event, during an event, and after an event. What's an acknowledgement of risk as a participant? What's acknowledgement of risk as an organization? And then obviously on the front end of it, decision making, and everything that's developed over time. And we went from high times of June saying we're going to be running things, to June, July, August saying we're doing pretty good, to September actually relieving some of the restrictions on size of groups to be a little bit bigger. Then all of a sudden October, boom, shut it all down again. And by the end of October, we basically are in a position right now where we have groups of 6 or less based on our civil authority that we made the decisions on. The goofy thing, like all of us are struggling with, is the interpretation of those civil restrictions and how to say, well, are we a social gathering or are we more like a construction site? Are we, you look over my shoulder right now. Wait a minute, right there. We took the work out of Trail Work Party. And so we really look at our events and activities as a social experience. And yes, we get some awesome stuff done. So it's been a challenging moment right now, where we're sitting here, really 6 people or less from 2 households or less within, and so basically it's dynamic husband, wife, partner duos, maybe some teenage kiddos with a crew leader parent going out to a trail, but a lot of scouting, a lot of assessment work going on. Shoot, it's in the middle of winter. Who really wants to do too much in the pouring rain? Although I will say, if we were running full, we would be between 4 and 8 trail parties a week. And that's where we are. So there's our story. Stop. There we go.
Good morning, everyone. My name is Geoff Eseltine. I work with YMCA of Greater Seattle's Outdoor Leadership Department, but specifically here for Bold and Gold, which is Boys and Girls Outdoor Leadership Development. Traditionally, we run 1 to 3 week backpacking, rock climbing, mountaineering, rafting trips. That was not quite the case this summer. Similar to what other panelists have shared, we really shut down a lot of things in the spring. I would say some of our biggest kind of challenges and hurdles to start with was one, trying to break through some of the siloing that was kind of occurring in the industry. It was really hard to reach out to folks and find out what others were doing since we were all scrambling. And I'm eternally thankful for everyone on this call for all of the resource sharing that was able to happen, because ultimately we're lifting ourselves up collectively and not necessarily getting exactly what we need from land managers or public health officials, et cetera. It really kind of came down to what this group was going to come together to accomplish and see through. And it's specifically to land managers, others have touched on it, but I would say we were leading land managers more than they were leading us. And that was definitely a different dynamic for me and my team here. That's not usually the case. And we did find some success in different places, but as I've reflected on this, I feel really thankful that they were willing to work with us collaboratively as land managers and understand kind of what these restrictions did and didn't mean, or could and couldn't mean. And that's not always been the case in the past. So I do think in that respect, this was kind of a positive outcome. The brief story that I would share that kind of summarizes what our summer looked like was we streamlined all of our operations. We only ran 1 week backpacking trips for teens. We cut out any technical trips that were mountaineering, rafting, or climbing to kind of streamline our operations and our risk. And we operated from about mid-July into September. And in August, we had both a staff member and a young person who had symptoms that could have been COVID. And as all of us are aware, every symptom is seemingly COVID. So we ultimately made the decision to conduct an evacuation and pull the entire trip out of the field, which was a hard decision to make, but was ultimately the right one. From beginning to end, it was about 14 hours before folks were back here and with their caregivers and on their way home. And our staff were in the same situation, and everyone was headed to get tested the following morning. And ultimately, the reason I kind of share that is it was scary. But the thing that helped us process this and get through that was not the COVID policies and protocols. The evacuation rested on everything we had always done, everything we had done in the past. And one of the big things that I have shared with a lot of folks is that while COVID did impact everything that we did, it was built on the foundation of everything we had already been doing. And my team, especially this fall, has spent a lot of time revisiting that as we look forward to next spring and summer, and just to make sure that we have those systems dialed in, because COVID is only going to be as successful in impacting our programs as we allow it in some ways. And that means we need to take time to think through everything that we've already traditionally done. And then honestly, I'll just kind of sum up, our experience was pretty positive. As with everyone else, we shut down in the fall as new restrictions have gone into place. Most of my team is furloughed, and we're optimistic and hopeful for some late winter or spring programming as things improve. But I'm incredibly proud of both our participants and our families and our staff. And ultimately, it came down to just a really high level of communication between all of those groups and being honest and forthright with each other. And obviously being adaptable and frankly, having a lot of grit. And I don't mean that specifically around COVID. One of the things that my team and I kind of sat down after the first trip left and realized was, well, now we have to do everything that we normally do in a regular summer when we put 400 people in the field. And that was the case this summer more than any other. And thankfully it went very smoothly, but ultimately we had to prepare and we kind of had to push through some of those things as well, on top of everything that was going on with COVID.
Hi, everybody. Thanks for being here. My name is Josh Olsen. I'm the co-founder and the program director of the Montana Wilderness School, which is based in Bozeman, Montana. I'm going to share a little bit about our season and what we did, and I'll kind of start out with a little bit of a story of we had a backcountry ski course that was about to go out sort of in the middle of March. We sort of scrambled to do whatever we could to see if we thought that was the right thing to do. And we ended up sending that course as sort of, things were starting to not going into lockdown yet, but more sort of people were, figuring out the CDC, like how contagious this was. And so we sent the backcountry ski course out with some screening ahead of time with temperature checks and that kind of stuff we knew would maybe help mitigate a sick person coming. And then as that course was out there, everything started to really change and shut down. And I remember sending an inReach text to Hannah Marshall, who's actually on this call or on this webinar. InReach text, I was like, well, the world you're coming back to is a lot different. And we had sort of tried to explain that like everything was closed. They could still drive through Yellowstone Park, which they had to do on the way home, but everything, all the restaurants and gas stations and stuff would be pretty closed down and things. So they'd have to sort of navigate a new world and try to prepare those students for a different sort of different world that they came than they saw when they went into the mountains. And so that's sort of how it all happened. But a little bit about MWS and our summer schedule, our summer season, which is sort of more the topic of this talk. So the Montana Wilderness School, we focus on students that are 14 to 18 years old, primarily Montana students. So 88% of our students come from inside the state. We operated in 2020 at about half capacity, which was only 64 students. So we didn't start operating until July 1st. Part of that was because of land management restrictions there. Region 1 had a restriction on outfitter and guides and group size on national forest land. And so we were abiding to that obviously through June. And then we just felt like we could kind of start in July with some better planning. So that was our operating season. We started a little bit later, about half capacity. We did a lot of what other groups did. I think limited group size, pre-expedition screening. We did 14 days of every student did a temperature check and sort of asking them some questions about COVID. We called them usually 3 to 4 times during that 14 days to check in with those students before they showed up to make sure that they were feeling healthy. And through that process, we actually screened out 2 students with signs and symptoms who ended up getting tested, and they both had COVID. So that sort of pre-course check-ins were hugely important for us. And then we actually wanted, a lot of our students, about 73% of our students are come on full or partial scholarships. So a lot of our students are below the poverty line, low-income students. And so we mailed thermometers to every student that came this year to make sure they had that resource to be able to take their temperature daily for those 14 days. We did on-site screening. So every time they would show up outside, we would screen those students with sort of basic COVID checklist and temperature checks and things like that. And we caught a student there who had actually not been doing the 14-day screenings, and we ended up sending that student home too. So I think that was a huge part of why we were able to try to sort of build these cohort models that we tried to sort of mitigate what we could in terms of those groups coming together, and then hopefully they would be COVID-free from our screening. We don't know that that's actually true, but at least asymptomatic when they came to our program. Really increased our hygiene protocols. We did masking in our buildings and vehicles. We did daily health checks in the field every day to make sure students weren't developing any signs and symptoms that could potentially be COVID. Due to some state mandates, we ended up moving to individual shelters on July 20th, which I can talk more about. That was an interesting conversation with the state and the health department about if a tent is a building or not a building, which was a pretty interesting conversation. And I think one of the main things for us was this week, we tried really hard to emphasize this like culture of mitigation. And when we were sort of putting this all together, our policies and procedures, we were kind of on our own for a little bit, and Hannah and I were just having like hour-long phone conversations about what to do. And then Dave McAvoy from ARI and Steve Smith here, like eventually we got brought in with the Youth Corps situation, and we saw what they were doing, and that was really helpful to us because we were able to kind of see what some other groups were doing. In terms of some key lessons for us, I think we tried really hard to establish a culture where we were working with, looking at the science, trying to be as compassionate as we could to our students, our participants, and also the greater community impact of like what it would mean for us to run, and having groups of 8 to 10 students together to kind of help shape our decision making and build a framework. Reassessing conditions all the time, like some of the metrics, maybe we'll talk about what we use. And then the other thing is just trying to say what you'll do and doing what you say was a big part for us, and just being like, this is what we're going to do, and we're going to make sure that we actually do it. And then trying to maintain that why of programming, like why is this so important for us, and why is it important that we get our students out in the mountains this summer. And I'll just sort of finish up with a case study because I like things like that. So I'm going to tell you a little bit of a story, and then Steve's going to launch a poll here, and you can make a decision about what you would do. But so at a course launch on the first day of a backpacking expedition, which was a 10-day course, we had a student that I'm going to call CB. They submitted their 14-day screening document, and they also passed their on-site health screening, and they didn't have a fever, report any signs and symptoms that could potentially be COVID. They hadn't been exposed to anyone, to their knowledge, that had COVID-19. And about 2 hours later, during the one-on-one check-in with CB, the student, it came out that they had brought some previously undisclosed medications that wasn't on their health form. And so we asked some questions about like, oh, what, you have these new allergy medications. What's the deal with this? How come we didn't know about these? Can you tell us a little bit about that? And the student said, well, yeah, my allergies have been bothering me the last couple of days, and they've been causing sort of a tickle in my throat. So I've got these new medications from my mom. She sent them along. And so we decided to call that mom and just try to get some more information about these allergies. We didn't know about them, new medications showing up. So while that's happening, we talked to mom. She confirms like, oh yeah, we bought him some allergy medications at CVS pharmacy and just sent him along. We're like, okay, great. Tell us about the allergies. What do we need to look for? That kind of thing. And sort of that's happening. He's packing up his stuff and learning, about what's going to happen on the course. And he gets a text from his friend. We actually hadn't taken their phones away yet. We take their phones away before they go in the field. That one of his cabin mates that he'd been at a camp 2 weeks prior had tested positive for COVID. And so he tells his instructors, his instructors let me know like, hey, this has just happened. So we immediately isolate CB. We tried to confirm that they were a close contact with the health department, sort of as defined by the CDC. At about 1 p.m., I was able to confirm through some pretty interesting phone call trees that our participant CB was a confirmed close contact with the health department. And he had been in close contact with someone that tested positive, and that the health department was in the process of informing him that he should be isolating for the next 14 days. So we actually found that information out before his family did. They didn't know that. He showed up having no knowledge about this other close contact or anything like that. So we then kind of had a decision to make, because we had, CB, our student, had rode in the van with other students for, which is a confined space, for over 15 minutes. He backed about 40 minutes. Everyone was wearing masks, but he was still within close proximity. He's possibly symptomatic now with his tickle in the throat. So we were on the phone with the health department, and the health department actually advised us that we could, if we wanted, to continue to run the course with the remaining students and send CB home, which we did. He went home because at that point, all the other students and our staff were contacts of a contact. So we sort of had a decision to make, and Steve's going to run a poll for you all, and you can all decide which one you think we should do. What do you think? If this was you, what would you do?
About half the folks have voted Josh, so we're going to give it another minute here. Okay, I'm going to go ahead and end the poll and should be able to show the results.
Oh, interesting. Cool. So there's a bunch of different ideas. I think there's a few options. I can sort of talk you through what we did. So the first thing we did was kind of consult the health department. And like I said, they were like, contacts of a contact, you can send the rest of those students. Seems like that's probably okay. And then I said, well, what happens if that student that we just sent home, he tests positive for COVID? Then what would you tell me to do? And they were like, well, then you should send everybody home, because then they all need to isolate. And you probably don't, if any of them are sick, you don't want them to be out in the mountains. I said, okay. And so then what we did was we kind of had two plans. Plan A was to try to call and talk to all the parents and say, hey, this is what happened. We want to give you the option here to come pick up your student and see if that, was the best idea. Then we talked to staff and all the rest of the students they're still kind of getting ready and sort of in a holding pattern. And, they were all like a little freaked out, but, they also were, some of them were, kind of wanted to go home. Some of them wanted to keep going. So we were sort of weighing these different options and talked to our medical advisor, and they were pretty hesitant to say that, hey, that, you can probably go, but you probably can't go. And so what we ended up doing was deciding to cancel the course. And part of that was, we were going to say what we're going to do, and we did what we said. And we said, if this was a situation where we had students get exposed, they were, close contacts, we didn't want to keep spreading that. If potentially the students that were just sitting next to that CB in the van, if they had caught it, and then we sent all those students into the field and those two spread it to the rest of the course, potentially then those other students go home and endanger their, family members or their sort of high risk categories of their grandparents or parents or something like that. And that sort of pushed us beyond our risk tolerance, where we thought, well, our students sign up for this, but their grandparents don't. So we decided to send them all home, and we did a pretty interesting thing where one student rode in the back of the van, and then one person drove down, and we individually shuttled them to meet with their parents and sent them all home. And 2 days later, I got a phone call from the health department, and that said, hey, your student tested positive. We'd heard from his mother as well that student CB tested positive. So all of your students and your staff are close contacts, and they all need to isolate for 14 days. So they were like, did you send them in the field? I was like, no, I sent them home. And they were like, great, good call. So we provided that information to them, and we had our staff get tested. They all tested negative. I think it was 2 students. The parents decided to have them tested. They tested negative. So we did some follow up with the health department, and they were pretty happy that that's what happened, and masks work. So that was one of the things we took away from that too, is even riding a van for 40 minutes, the mask still helped. So that's sort of the end of our little case study, and I think we've got some other stuff that we're going to talk about, but I'll hand it over to Steve.
I just, before Steve goes, I just put in the comment there, I mean, you'll never know if you're right, but you'll definitely know if you're wrong. In this case, you actually got to know that you made the right decision. So many times over this 9-month period, I've had decisions that I've had to make that I absolutely still don't know if I was being too cautious or what, because there's just no way to know. And it's really that risk tolerance piece. But then also like so hard to know.
Yeah. And the other thing I'll say is like our staff, I asked them all, I was like, well, what do you think? Like, how do you feel about this? And I want, honestly, and some of them were like, this seems like too much. Like I feel, we were sort of waiting for the health department to get back to us. And that was a big factor in me deciding like, hey, if anyone isn't feeling like this is the right thing, regardless of what the health department says, let's send them home. it's just backpacking, like we'll figure this out. And so that was a big part of what was leaning us towards canceling anyway.
Mm-hmm. Really wonderful opening stories from all of you. And thanks so much for that. A lot of little nuggets were woven into all those stories. So let's try to isolate and focus on a few key things. And the first one I want to ask each of you to succinctly speak to is your criteria for deciding before the students ever arrived and before the vans got loaded and before the equipment got packed. You all had to arrive at some kind of organizational clarity about what constitutes a red light or a green light. How do we know if it's okay for us to run these programs or not? And so without necessarily repeating something that a previous panelist has said, I'd love to hear from any of you that would like to share just a few examples of your criteria and how you made those decisions.
I'll jump in and say the obvious stuff that we're focusing on: ICU, ER availability, sort of tracking data. Another huge issue was PPE. As we remember, things were pretty short. But the bottom line was we developed a 9-point decision-making rubric that we evaluated sometimes twice a week, and it had a 4-week arc out. So we were trying to make decisions. Let me just put it in the chat here.
And for me, it was then taking that type of decision-making matrix and having some sort of group. And so our group was a safety procedures group of retired nurses and doctors and folks from both our board, staff, and lead volunteers. So same kind of thing.
Yeah, I would say for us, we've had a really incredible relationship with both the state and the county public health and really provided some bumpers for us that felt very good. I would say the extra layer on this is that after we felt like these things were in place that have been mentioned by Jay and Steve, is that then we needed to make a decision about whether we should do this, which I would say in some respects was the harder of the two things, given that we're talking about people's lives here. And it was a challenge to revisit that every day, the entire time we ran programs.
Yeah, it was that for us as a volunteer stewardship organization, it was like, are we essential in this moment? And it's been so hard because every communication from the governor's office and everybody else is like, hey, you can't do anything with each other, but just get outside, go for a hike, do something outdoors. And it's like, well, now the trails don't have the staff out there, don't have the volunteers keeping them up. So we're in this weird, we're considered non-essential, which breaks my heart, but it's true. It's unfortunately true. And yet now people more than ever are getting out on trails. And so that was really that part, what you're saying, Geoff, is like, that was the last bit. Oh gosh, are we essential or non-essential? It was tough.
And
so,
just a quick addition, because I think Geoff's point was great. I mentioned this 9-point rubric, and 8 of them were all these very measurable stuff. The 9th one was, is this congruent with our values and our commitment to the parents of the kids that we're bringing in? And that was we went through, we'd have an hour discussion, and the first 5 minutes were 1 through 8. And then the last 40 minutes or more was, are we doing the right thing?
So the thing that circles for me from this discussion that we're having, and the term that arises for me that we're not explicitly using, is this concept of risk tolerance. And how do we clarify our risk tolerance as an organization while acknowledging that there might be very different ideas of tolerance for risk by the participants, by the families, by our stakeholders and board members, by the leadership, by your communities that are looking to you and saying, I worked with some programs where the communities were like, why aren't you running your programs right now? This is crazy. We need you. And others that were exactly at the opposite end. where the communities were like, we love you, we love your programs, but now's not the right time to be doing this in the pandemic. So that was all across the spectrum. So I'd love to hear from any of the panelists how you had those conversations around risk tolerance, especially in cases where maybe the staff felt one way and the leadership felt another, or you had maybe factions that were on different pages with that. Does anyone have an example or two of how you worked your way through that?
I mean, I'll speak to this from the Y's perspective. The Y, specifically here in Seattle, is a great number of outdoor things. It is not our bread and butter. And we met a lot of institutional resistance at the beginning of this, being asked, why were we doing this if national leaders weren't doing it? If we're a small program that's regionally based, what made us think that we had the know-how, the expertise, and the guidance to make this work? And it was a long process. I mean, it was many weeks of ongoing meetings and playing go between public health, our medical advisors, our land managers, everyone. And ultimately, the thing that kind of pushed it over the edge was we had made a very strong case that we had thought through almost everything that we could have thought through. And they felt confident that we had taken the time to build off of what we were already doing foundationally, and then to bring a COVID lens to all of that work. And it does not, I don't want to make it sound like we did not revisit this conversation seemingly every 12 hours while we were running programming, but it did get better. And I think we needed our organization to trust that we knew what we were doing here, and ultimately that's where we got. And I think the reason we did that is there's a lot of education to be had. Our organization doesn't just do outdoor programming. So we needed to spend a lot of time helping our board, helping our volunteers, helping our organizational leadership kind of understand what it is that we do and how it can work in a COVID environment.
Yeah, I mean, that was something that happened to us quite a bit, where we had the whole spectrum of like, some people in leadership staff thinking like, hey, we're good, we can run this, we just need to do these protocols, and we can make this happen. And the other end of the spectrum, with like our attorney being like, I don't know how you think you can do this when like big programs that are, huge and national programs aren't going to try to do this. And I think we felt like we had really solid reasoning that like, hey, we're a pretty small program and our kids are local. Like, I mean, we're at the time, the rate of infection in Montana, particularly in July and the first part of August, was like relatively low. And, our kids aren't flying here, they're driving. So we felt like pretty confident in some of those pieces. And then the mitigation strategies that we were trying to put into place with the screening, I think convinced particularly our attorney that like, hey, Matt, maybe you're onto something here. Maybe you all can pull this off if you're thinking about trying to think through this. And I think the other thing is having those bright lines in the sand where you're going to say, hey, we're going to call it off, or we're going to send them home because this is beyond our risk tolerance. And we had a couple cases like that. We had a student come in and they hadn't done their 14 days of screening. They had sort of dodged the bullet or dodged it on the phone and hadn't done it. And, our staff sent them home. They said, well, sorry, that was part of the deal. You agreed to do this, so you got to go home. And I think things like that really helped us to be able to try to figure out why we felt like we could do this, especially when we had this different range. And, I have a really high tolerance for uncertainty, but that doesn't mean that my tolerance for risk is a little bit different. So I think we just had to balance those types of things organizationally.
Hearing you. Oh, go ahead, Jay.
Just a quick example. Most of our focus of these 300 plus kids in 3 states, 40 crews, were backcountry. And once they got there, they were safe. We also ran some community-based crews in Tacoma, Portland area, and Eugene. And one of the interesting risk tolerances piece of that, as our first half of the summer, everybody was excited in June, levels were going down, things were ticking off. But July, we just saw this huge uptick. And then we were looking, at our weekly metrics for infection in the 3 cities that we were running this, and they were getting really high. And as we were thinking about, should we still be doing this? Because very different protocols, right? Those kids are going home every night. potential for exposure. We're doing all the masking and PPE, all that stuff on crews, where our backcountry crews don't do any of that. They're healthy family units. And ultimately, parents helped us make that decision. They said, our kids are safer with you in Tacoma than hanging out with their friends at Tacoma Mall, not masked up. And the parents were telling us their kids were coming back from our programs as being like more responsible COVID managers. And not just for themselves and their families, but in talking to their peers.
A theme that arises for me from hearing all of you, and I think Geoff mentioned this at the very beginning, and especially I think Josh's story kind of illustrated it, is the things that helped all of you succeed this summer in running your programs during this pandemic was all the work that you'd already done in advance. Having policies and procedures and training and a place where people are sharing and reporting their incidents and continuous learning, and either an existing risk management committee or the ability to put one quickly together like Steve Kruger did, things like that. So I really think all of you were well served by all the work that you had done in the years leading up to this challenge that helped you be resilient and running that quality program that was able to thread the needle and find a way to deliver local programs, local kids, stuff like that, at times where larger organizations might have really been struggling with their model to do that. So just wanted to kind of highlight that piece, that your hard work in the years leading up to this, I think really served you well in this case. Another theme that I heard was this question about the impact of COVID on your desire for equity and inclusion and diversity in your programs. And Jay alluded to it pretty early here, but just want to focus on that piece and see if there's any additional comments, stories, pieces from the participants to share in the chat around the impact of COVID on your ability to focus on your equity and inclusion efforts.
Well, I'll jump in again with that. Going back to the core forum, Steve and I made a presentation there about mental health on crews. And we talked a little bit about Northwest Youth Corps' commitment to our medical evaluation process as not being screening, because we're focusing on trying to be more inclusive. And we found that we needed to completely change that. The things that we were willing to accept the management of on our programs under normal circumstances versus the realities of what it was going to be like to run in COVID literally did turn our program from a medical evaluation to a medical screening. And so it was very, very painful step back, particularly around things that we had figured out how to really effectively manage in backcountry settings, including type 1 diabetes, and also a number of meds that were coming onto our programs that were mostly dealing with mental health issues. So that was in addition to the actual single identity programs that we were focusing on that we could not run. We found ourselves taking a big step back on our commitment to the conditions that we wanted to be inclusive of. And that was hard.
Yeah, I'll echo a little bit of that, what Jay just said. That I think, our tolerance for, students that have some sort of pre-existing condition, definitely we thought more about that this year. Which was unfortunate because I hate to see that happen and puts barriers up to kids that want to come. Another story from us is that we had 3 students come from the Crow Reservation in South Central Montana, and I honestly was like losing sleep over those kids potentially getting exposed, on our program and then going home to their tribal communities that are just vastly disproportionately affected by COVID. And I was like so nervous about that, and was trying to figure out anything else we could do to try to make sure that those students, didn't, unbeknownst to us, somehow take home back to their reservation community. And so we tried a lot of different things with like really instilling in that course that like, hey, when you all go home, you got to be really careful, minimize your contacts out after this course for 14 days, keep screening. We give you that thermometer. It's at your house. Keep screening yourself when you go home, and trying to really emphasize that with those students in particular, just because their access to healthcare is so disproportionately unfair, that it was one of actually the things that stressed me out more than anything this summer, is like those 3 students, and they didn't, just to our knowledge, they didn't, weren't exposed, didn't bring it home. But it's hard because I don't think we were able to reach out and, meet our goals that we want to in terms of trying to, make ourselves welcome to every student, just because we didn't know. I don't think we knew how to operate at that point, and reach out to those different communities and those students with pre-existing conditions. I think we'll be better this year.
So let's shift to a bit of an intellectual topic, which is this concept of emergent risks. And let me define that a little bit for everyone. So traditional models of risk assessment and risk management often take a very linear approach, like dominoes lined up. And we're just going to identify the hazards. We're going to identify the mitigation steps. We're going to intervene in this linear process of dominoes falling, and we're going to build this airtight system to manage risk in our programs. And it sounds good on paper, but it might work in a conveyor belt. It might work in a very structured environment. It doesn't really work in the socio-dynamic environment of the real world, especially during a pandemic with all the shifting, moving parts. So rather than looking at it in this sort of traditional linear way, we've seen models like the Swiss cheese model that I'll share a link with all of you afterwards, that talks about lining up different layers of defense against the pandemic. And even more complex than that is a systems thinking approach, where we look at the interaction between all of the different risks that create new risks, and how when we manage one risk, we might actually create new ones. I'll give you one example. Something that I've seen a lot of organizations do to manage the risk of COVID is to have all the participants drive separately to the trailhead, where normally they might transport them in a single vehicle. And they're managing the risk of COVID, but now they're putting all of these tired drivers on the road after the program, driving on Forest Service roads that they might not be familiar with in variable conditions and so forth. So they haven't actually lined up the risks and managed them. They've created a new risk, an emergent risk, as a result of their managing this other risk. So I'd love to invite the panelists to just comment on, extemporaneously comment on some of the emergent risks, things that came out of our attempts to manage COVID that weren't there to begin with. And certainly welcome, comments from the participants. If you could share, examples that you've seen of new risks that came as we focused on one, we created new risks that weren't there to begin with. I hope that is a clear principle, emergent risks. I find it to be a fascinating one. Invite any of the panelists to comment on maybe an emergent risk that you observed this summer.
One that popped up just in the last couple of weeks at our monthly safety crew meeting. We review our incident reports and we try to pull out any themes or things like that. And one was stumbles and trips, slips, trips, and falls, right? In the safety world, that's like the most common thing. We recognized that. And then at the meeting, the 2 reports that came up, they shared, I was wearing glasses, I had a mask on, I got fogged up, I lost kind of my equilibrium and, line of sight, and stumbled and tripped and hurt myself. And so, just the idea of informing our volunteer participants to say in advance, another before the event preparation is consider wearing your contacts, please. Or if you don't have contacts and you got glasses, let's put you on a task during the event that is not going to put you in a spot where you have to wear your mask. Give yourself more space and put you on the end of a trail crew. So that was one element for us that emerged just recently.
I'll piggyback off of that. In our analysis coming out of the summer, slips and falls are always our number one incident accident. And when we were kind of digging in deeper on this in October, one of the things that we took away from that was we had a number of participants who slipped and fell while they were washing their masks as they were trading them off from day to day and disinfecting them. And it was just one of those things that we increased the number of times that people were spending near the edge of the water, and therefore we increased the likelihood that there was going to be an incident over the course of the summer. And we need to spend more time with our staff and our participants preparing for that. And it was a miss, honestly. It was not something we had considered going into the summer. It certainly came up, and as always, slips and falls are something we can work on.
I'll throw a couple things out that fit in this category but are a little odd. And I'll also say that there's both emergent risks and emergent successes that were unanticipated. One emergent risk for us was COVID fatigue. And it's not like the exhaustion of like managing it. It's the like, oh, I'm so good at this now that it's just, I don't need to think about it. And that meant that really thoughtful staff that were managing it were not then moving information up the chain. They say, okay, we got it. We're following these protocols. And all of a sudden the protocols replace and the organization needs to know about these things, including a concern about testing, getting tests, and ended up being negative, which was great. But there's this whole parental contact piece and all that didn't get done. Another example of that COVID fatigue, that we're just so used to it and not thinking about how other people feel about it, is we bring our crews back to our Eugene campus for what we call the big clean at the end, where all the work is being done to clean tarps and tents and tools and vehicles and all of that. And we had all these healthy crews come back in to all these other healthy crews. And we had this mass of healthy people that were wonderfully being together. And they were like not socially distancing, and their masks were on sometimes or they were off. And the public was appalled. And we were like managing our Facebook feed. And we had one staff member that tried to get into a Facebook, like, I can solve this on Facebook. No, you can't. We needed to do a mea culpa, and we need to figure out how to, and then be very proactive for future activities like that. And then one example of an emergent, like, wow, this is amazing. And I will guess there'll be some head nodding with this, is like, we really upped our hygiene on our programs, focused on COVID, and holy cow, man, we just had the healthiest program we've ever run in terms of gastrointestinal stuff, in terms of like flu-like whatever. It's like we just had incredibly healthy crews, and we are post-COVID, we have whole new hygiene regimens that we are sticking with, and now have seen the evidence of solving a problem like that we will put to other issues that we have around our risk management.
Yeah, the mask while driving was something I was a little stressed about, because people wear sunglasses and fogging up and stuff like that. So before we started doing that, I tried driving to work with a mask a couple times, and I was like, how dangerous is this? And so I think that was something we worried about, and didn't seem to cause problems. We worried about it. The other one that I think we came up was like stress, particularly on staff members, sort of causing like a psychological, feeling of this high level, increased level of stress, and sort of distracting them while they're in the field. And so it was something that Hannah Marshall, who works with me, was really on top of, and trying to make sure that we were really checking with staff about like their psychological well-being before they went into the field, just to try to mitigate that turning into sort of any sort of being distracted. Distractions can cause poor communication. Poor communication can cause that, incidents to happen. So, that was something we were really trying to be cognizant of, and trying to get everyone to sort of slow down as best they can and still communicate, even if they were feeling this like external global stress on them because of the pandemic, or people in their family or friend group being sick or something. So that was one that was an emerging risk that we watched out for.
The last piece I'll just add to this. I'll add a few more emergent risks, actually. I've seen situations where participants weren't allowed to share tools that they were using for trail maintenance projects. So someone gets stuck with the same tool for the whole day. And now we see someone using a pair of loppers as a hammer, or using the wrong tool for the wrong job, things like that. Or maybe repetitive use injuries because they're using the same tool and doing the exact same job for 5 or 6 hours instead of, swapping around and doing the normal kind of things that we would do. Another kind of, I appreciate Jay bringing up not just emergent risks, but emergent positive surprises. In the same way that a lot of programs had very low instances of GI issues because of their added increased efforts around hygiene, it also became clear to me in talking with these folks on the call and others that behavioral incidents really went down this summer. There were far fewer behavioral incidents than normal. And I find that to be a remarkable story of folks that were happy to be out, happy to be on this program, more grateful perhaps than usual for just being together in a group, and maybe an added focus around teamwork and clarity and team building. And Amberly in the chat adds, numbers of pre-program communications and touches, with the students before the program even begins, and things like that. So I think that those are really remarkable positive things, capacities that we have that maybe arise from this pandemic in a helpful way.
Yeah, that's so important. I'll be very transparent. There are some things at Northwest Youth Corps where we lost focus, and we're a conservation corps. We're very work oriented. The work often leads the way, and it all works. And we have good staff. We make it happen. But we were so clear with our staff that the work was second, that the well-being of the crew was first, and that the focus on not just the protocols, but the checking in and the recognition that things could be going on at home, in different ways, for these crews in this pandemic that we needed to be thinking about. And you're exactly right. Our behavioral issues just crashed. We hardly had any. And I think Amberly's points were well taken too, just about how often we were talking. People really knew what to expect in new ways, I think, because of that level of conversation.
I want to make sure that we target a few of the very specific questions that came in the Q&A with the time, or it came in the chat with the time that we've got. And Kathleen asked specifically about tents and backcountry tent protocols, and how, for those of you who are doing overnight trips, if you could just talk a little bit about maybe like what we thought we knew about tents and the pandemic back in March, and how are you thinking about it now? Or what advice would you have around, tent protocols? Let's presume for a youth backcountry situation.
Well, for Northwest Youth Corps, if it's multi-day programming, we're bringing healthy groups together and creating healthy groups that need to be protected from outsiders, but not from themselves. And so that made tenting pretty straightforward. And I think there was some thought at the beginning, well, let's make sure that we're, foot or head to toe is revert. And by the time we were well into the summer, we just said, no, we're making assumptions about being in vehicles together, being healthy, being intense, and doing all that. And so we just gained our confidence that tents were a safe place.
Yeah, I think we were the same as Jay. We this idea that we were all bringing what we were hoping as COVID-free groups together. And so initially we started out with people sharing tents just like we normally would. And then we ended up having a change in our sort of governmental mandate about buildings and wearing masks, and we didn't want students to have to wear masks. And so I had an interesting phone call with the governor's office about, and they actually disagreed with the county health department about if a tent is a building. And I was arguing that it wasn't, and they were arguing that well, you could have a tent and have a wedding under a tent, and that's a building. So it was a pretty interesting conversation. So ultimately, we decided, fine, we'll just go to individual tents. So that's what we ended up doing for the last part of our course, which introduced some other emerging things. Like typically we have tent partners. So if you go to the bathroom at night, you wake up your tent partner, because we operate in grizzly country. So that's something that we had to sort of adjust that a little bit. And I think we will go back to sharing tents in 2021 is our plan. So, and Jay, we had the same conversation about if sleeping head to toe, and I was like, I mean, they're riding in a van together. I'm not sure that this head to toe thing's really changing anything, but we ended up doing solo tents for the last 4 courses, just sort of because that was what the health department and the state thought we should do. So we did.
For us, I mean, we use open air mids, so that's pretty helpful. We kept our tent groups the same, and ultimately, every single group that could just camp under the night sky, that's what we asked them to do, and we had a mid set up for folks to change in. That's not possible for all weather conditions and all locations, but it did go very well. And I would say, from a parent, caregiver, community standpoint, this tent question was the number one thing me and my team were asked repeatedly, seemingly every 15 minutes. So I think regardless of what your plan is, just making sure you have it and are ready to fully articulate it, it's going to be pretty crucial as we head into the new year.
There's an emergent risk with individual tents as well, especially for programs that are, maybe taking kids out into the backcountry for the first time, or folks that they may not be that comfortable in the wilderness to begin with. And now we're asking them to sleep all by themselves in a tent. And that ratchets up anxiety and homesickness. So we can manage the risk of COVID, but there are domino effects from that with the mental health perspective and so forth. So I love this concept of emergent risks and not acting like COVID is the only risk that we're managing out there. There's a question that came into the chat around transportation. And I think that, like tents, that's been a real sticking point and a challenge state by state, different guidance in different states, different thinking about it. Does anyone have any overarching either advice or comments about how your organization has approached transportation?
I'll jump in here really quick. This was something that came up in our groups a lot. So we tried to keep the cohort together. So even support staff weren't considered part of the cohort because they go home at night and things like that. So the students and their staff that they were working on would drive their vans, and they would wear, once we had a mask mandate statewide, we started having them wear masks in the van. But then as the support staff wouldn't ride in that van because they were out of the cohort. And then as it's sort of the way we tried to manage that. And then they would drive in a separate vehicle or something like that if they needed to support the course in some way. But yeah, we tried to keep the cohorts in the groups, or solely in the transportation. We didn't distance in the cars or in the vans. We had everybody sit next to each other like we normally would.
So for us, unfortunately, that wasn't an option. This was an area where both the state and our public land managers had some very strict regulations. We had to split our groups between two minibuses and have folks spread out, windows down, masks on, which was not a super enjoyable, 3-hour drive each direction, but it worked. Speaking of emergent risk, we had to leave a lot of our buses parked at trailheads for weeks on end, which was also a concern, but thankfully no vandalism or theft or any issues there. What I would say, though, is that this, for some reason, was an area that a lot of land managers had as a sticking point. And we did have one land manager that wouldn't budge on the way that we were doing it and wanted us to be even more spaced out than we were, which would have required us to only be able to put a driver and 2 participants on a 15-passenger minibus. So ultimately, we weren't able to operate in that park this past year. So it was an area where we had been really proactive, but it's also something I'm currently working on now because it's a concern. Our experience with land managers has been that we've had to do a lot of leading, and in some ways, they have been far enough behind where the science has been that it's prohibited us from operating. So again, I would encourage folks to keep that on your mind because it definitely was a major hurdle and a barrier for us this year.
Yeah, I could probably guess who that might have been, Geoff. For most of the transportation we did, Josh really covered it. That was our approach. But for our community-based crews, we did have folks that were fully masked in vehicles with windows down. And we actually reduced the size of those crews just to have a fair amount of space between them.
We also tried to minimize our stops at public. We drive a lot. We jokingly call it the Montana Windshield School. So we tried to manage our ways to stop, and we used like rest areas as opposed to gas stations, so that we wouldn't be having students go in and out of businesses. That was something else that's kind of on the transportation side.
Yeah, I would echo that. We mapped out our stops along our trips in a way we'd never done before. So like trying to stop at state parks where we felt like we had a little bit more control over the environment and who was around. And probably that's something we'll continue moving forward. I think it was just helpful. One less decision for folks to have to worry about while we were traveling.
We have just a few minutes left, and I want to make space for any questions that burning questions people have that we haven't addressed. Feel free to unmute yourself and ask, or put it in the chat.
Steve?
Yeah, go ahead, Reb.
I had a problem. I don't know if it's unique, but it involved a program here in Houston that takes underserved high school age kids out of town, generally to national parks. And the issue came up of quarantine. What do you do about quarantining at a remote spot? As the program itself has to either move on or end. And the problem here, frankly, was the ability of families to sustain a child in quarantine over an extended period of time.
Reb, do you mean quarantining before the program starts?
No. This is afterwards or during the program.
I see. So if someone displayed symptoms or had to be isolated for some reason, and there was a need to medically quarantine them.
Exactly.
I see. Well, that did occur with a few programs that had to grapple with that this summer. So I'm curious if any of the panelists have comments around either dealing with that or your preparations of how you would deal with that.
Well, Reb, hi. It's good to hear your voice. We had these very specific quarantine protocols if something happened in the backcountry, and we spent a lot of time with them. We talked to people. We got it about halfway through. We said, "What the heck are we thinking?" It's like if we have somebody that needs quarantining, we've got to get them out. And if that means that we need to disband the whole crew or whatever, that's what we're going to do. We also at one point had a re-entry plan, especially for our young adult crew-based programs, where we would focus on eliminating any interaction outside of their crew for the last 2 weeks of their program, so that when they came out, they could be considered COVID-free. And we ultimately realized that we were attempting to tell adults what to do about how they were going to be managing their lives post, and we actually took a step back from that as well. But we're actually currently reviewing. We have a small team where we're reviewing our protocols thoroughly to say, okay, we take a deep breath. We now have 7 months of experience. The science and the data have improved. Things have changed. We're completely reevaluating that. And one of those early low-hanging fruits was this idea that we started this backcountry quarantining. And so we're not going to be likely including that in our protocols moving forward.
What this program found it had to do was put these kids, and there were a couple of situations, in a motel somewhere. And the group again went on, and it wasn't a matter. I mean, it was unheard of that you would take them to an airport and put them on an airplane and send them home in that situation. And the family, frankly, could not afford to have a kid in a motel for 10 days or more.
I was talking to a school very early when all the the pandemic it hadn't even been declared a pandemic yet, but we knew about the virus and we knew that it was here in the US. And they had a student come down with very COVID-like symptoms on a backcountry ski course. This was around March or April. And they were in a pretty remote place, and they were prepared and were getting ready to basically put the kid up to quarantine the kid at their base camp there for the required period of time. And were able to work with an airline and with a local physician to actually approve putting the child on the plane and sending them home. And would we do that now, knowing what we know? Maybe, maybe not. But that's actually how one organization that I know of dealt with that situation way back in March. So, I think one of the biggest problems is very different state by state issues that we see. And in the absence of a national leadership and a national approach, we've had very different county, state, and regional differences in how to approach situations like that, which is a lot harder for a big organization that operates in different places than it would be for a program like Montana Wilderness School that operates in Montana. So
can I say on that, like, there was that, and then for us as a volunteer organization that works on local, state, and federal lands, those systems are going to be there no matter what the federal policy on COVID was. I mean, one forest versus another forest is going to make decisions entirely different. And I think one of the values that I found was bringing partner organizations and those agency people in on those Zoom calls that were doing, collaborative just updates. And so in Washington and Oregon, there's a group called Recreate Responsibly in Washington, and in Oregon, there's a monthly Trails Coalition stewardship call that happens. And I feel like that allowed some of those things that weren't being brought down by a federal mandate or, protocols in place. It created this energy where everyone was saying, oh, they're doing that. I can feel a little bit better about that. And that goes from both the partner organizations and the agency folks. And I think it did make an impact for those on both sides to just learn and get comfortable, be risk tolerant. So silver linings, those things and those systems, I feel like are now those relationships and those communication lines are there. And I think they're not going to go away. They're maybe even going to be used in different ways now that they weren't before. So I don't know, in the world of youth corps, group phone calls or this type of webinar, but that would be something that I'd recommend has been a silver lining emerging opportunity is folks are working together and talking a fair bit more, and things are moving a little bit in different ways. So
that's a wonderful point, Steve. And what we've seen with Recreate Responsibly, and I've been a part of the steering committee for that effort here in Washington, is not just waiting for the governor's office to provide guidance, but communicating up to the governor's office and telling what it is that we need and where we see gaps between what a restaurant or a church is allowed to do indoors versus what we're allowed to do outdoors in a much safer place, and being more proactive in those relationships and communications. And I think it's been a very positive, yet another example of a positive thing that has come out of this incredibly difficult and unfortunate pandemic. So we're basically at the end of our scheduled time here, but I'd love to just open up the floor for any of the panelists if you have closing comments or advice for folks that you'd like to wrap up with.
I'll just go and say our organization, we were born out of the Eagle Creek fire in the Columbia Gorge, where we had volunteer crews going out in areas where the terms hellholes, torpedo logs, beach ball boulders were common. And my takeaway from this experience through COVID and building this is kind of hearkening back to our other panelists saying we had these things in place and had an experience and an idea that we were confident in what we could do. And I think evolving with all the science and all the ups and downs over this year, I think we'll continue to feel confident. And where we make those decisions and propose it, our land managers are confident in us too, and feel really good about where we're going with our programs in this era, in this moment.
I'll just say two things. One is that I just can't imagine our success without the level of collaboration that occurred throughout our industry. And I think that's from everything from sharing protocols to being able to hire folks for parts of our industry that were much more crippled, like particularly, place-based experiential education programs that had incredibly talented staff, and just making all that work. And I would say, second, that we learned a lot around where we can move forward effectively and successfully on rebuilding our commitment to diversity, equity, and inclusion. But a lot of it was the timing and the uncertainty that really impacted our sort of sense to step back on that. And so we are very much moving forward again and at looking at how to effectively accommodate those commitments into everything else we're doing in a COVID environment and then beyond.
I think for me, I've said this to a lot of folks, it would have been easier not to do this. I hope, this was not an easy task. It will not be an easy task moving forward. And it is absolutely worth it to keep our staff working, to keep our young people out there, to support our community. It has been worth every kind of agonizing decision and moment of stress to get to this point. And I want to emphasize that, especially right now while we're in the midst of the winter, it's kind of hard to think back or forward. But even though it's been hard, I'm incredibly proud of the work that we've done here. And I think ultimately this just kind of comes down to how well we can rely on the folks around us and the folks in this community. And I guess, just encourage everyone to try to avoid going this alone. Talk to people around you, as other panelists have said. There's a lot of resources out there. We're still on the cutting edge of all of this science and understanding around COVID, and I fully expect a lot to change in the next 3 to 6 months. And I am looking forward to connecting with folks on this call so we can share resources and learn from each other and offer really great programming opportunities and get back to more of what we used to do as well. So I think that's been my takeaway to this point.
Yeah, I'll just close with saying that I think for us, hope is a poor risk management tool. So I think that the harder you work, the luckier you get, right? So I think, putting in those policies and procedures and figuring out how to make this happen. I would also say that creating a culture in your organization that is everyone buys into this, that we're all in this together, and creating routines, creating regiments, training regiments that create routines and routines to keep people safe. And I think if you sort of put your energy into that, it can definitely help help with the mitigation of some of this. I'll just echo a little bit what Geoff said. I think for us, we're really happy that we were able to offer these programming to our students, and some of them found it very cathartic in this time of confusing and turmoil and uncertainty. And so I just think about our students that, what would they be doing if they weren't able to come? And that makes all the hours, the sleepless nights and the hours trying to make this happen worth it. And to see them come home from their trip after 15 days or 21 days, with these huge smiles on their face and new friends, and, after their schools were shut down and they get to hang out with kids their own age, that made it all totally worth it. And so I think I'll just echo too that the sharing of resources is definitely the bridge to success, I think.
Well, that's a perfect note to end on, I think, and I certainly hope that the resources and the lessons learned and the comments and the inspiration, from these folks' hard work and success is inspiring for all of you, whether you've already been running your programs or you're relaunching in 2021, or you're deciding that the time isn't right for you. All those are great and viable options. And I certainly hope that what we did here today just deepens your understanding of those decisions, talking about risk tolerance, talking about your mission, talking about the benefits of being outside, talking about those emergent risks so that we're not just tunnel visioned on COVID, but we're looking at the bigger picture. And doing the things that we need to do, as an outdoor industry to help our society recover from this really difficult year that we've had. So I think all of your programs are super important pieces of that recovery. And I'm very grateful to our 4 speakers today and their organizations, not only for being with us today, but for the remarkable hard work that you put in, not just this summer, but in the years leading up to this summer, to be able to be resilient and to run your programs and to give all of your participants and staff those opportunities this year. So thank you all so much for sharing that and for being so open. Northwest Youth Corps had their standards published way back in the spring. And I think it really created a domino effect for a lot of other organizations to have courage to move forward. And all of you who've shared these things. So I will send around a follow-up to this call that we just had today. I will also send around a feedback form, and I'm going to drop the link to that feedback form into the chat right now if you want to just give us some feedback right away. Here it comes. And one of the topics we talked about today was risk tolerance. And our next webinar series, we're going to take a little break over the holidays, but we're going to start again in early January. And there's going to be an entire webinar devoted to risk tolerance and how do you think about that and talk about that and explicitly clarify that and codify it for your stakeholders, for your staff, for your students, for the communities that you work with, and so forth. So that's a relevant thing that comes not only out of this talk, but in general, that's a positive thing for you to have clear for your organization. So I hope to see many of you at that. Hope you all have a great, healthy break over the holidays, and really appreciate everyone logging on and being with us today. And I'll send around some follow-up resources and other communications as a follow-up to this webinar today. So thank you all so much. Big virtual round of applause for our participants and for each other for sharing all your great questions and comments today. And we're going to go ahead and wrap up there. Thanks so much.
So long, everybody.